Hi, Michael from Happy Chiropractic. So you've been told you have arthritis. That's unfortunately a very common diagnosis given to people that you have arthritis, and usually, or in many cases, people are told you've just got to live with it. Well, I'm here to tell you otherwise, particularly if it's osteoarthritis, also known as spondylitis or degenerative arthritis or wear and tear type arthritis, that there are things that can be done not to get rid of your arthritis, but to help you live far better with it. So let's talk a little bit about what osteoarthritis is first of all. Osteoarthritis, or wear and tear arthritis, is exactly as the term states, wear and tear. It's where the bones start to compress into each other and the spacing between the bones, particularly in the spine, starts to reduce. So we start to get the bottom of one bone and the top of the bottom of one bone, the top of the bone underneath starting to move towards each other. If I show you a model of varying different, or plastic model of the spine, you can see through here that there's actually quite a space of the disc, and there's space between that bone and that bone. And then when we start to look at this one here, and we can see one bone and the next bone becoming a lot closer to each other, that's just an osteoarthritic or degenerative process, which probably takes place over the course of a decade or so. So what does it tend to feel like? Well, people with osteoarthritis, they tend to feel like their spine is stiffening up, jamming up, can't move as well as it once could, or they can't move as well as they once could, and there can be pain associated with it. The thing about the osteoarthritis is it's more of a compression type issue, a lack of space type issue, rather than an inflammatory process as some other arthritises are. So because there's less inflammation, it's more of a compression, we need to try and do some things to help you decompress, to get a bit of space into those joints so that they can start to move a little bit more freely. So some of the things that can be done are some general stretches. So we can do specific stretches to do with the neck, if the neck is the area, or the lower back, if the lower back is the area, to bring global or all-round motion through the joints. That definitely can help with the symptoms of osteo or degenerative arthritis. The other thing is to have some hands-on work done on the specific areas that are osteoarthritic and start to try to loosen some of the adhesions and tension through that joint, and just start to get the joints to start to glide and move much more freely over each other. That tends to increase the movement and decrease the stiffness and also decrease the pain. Some of the other things that can be done are we can also look at it a little bit through our diet. We can make sure that we take fish oil supplements. They can help people, or certain other supplements, chondroitin sulfate, can also help people with osteoarthritic type symptoms. But the key thing I want to take home is it's not a sentence. It's not a sentence that there's nothing that can be done about it. People with osteoarthritis can have dramatic improvement in their quality of life if they understand the steps to take, which are often very simple, to help to alleviate that compression that is going on. So I would thoroughly endorse, if you hear the term that you've got osteoarthritis, or that you know someone that's got osteoarthritis, to consult with a health professional that understands that it's not a doom and gloom scenario. Things can be done, hands-on things can be done, advice can be given to really help you live a lot more freely and a lot more fully, even with the osteoarthritis. I hope you found this useful, and I hope that it inspires some hope in you if you are suffering with osteoarthritis, or if you know someone that is, that you could forward this email on to them and this video on to them, and they can actually have a look at what we've just discussed and bring some hope into their life moving forward. Thank you very much and have a great day.